say one thing, ki on Republic Day or Independence Day, na, we send messages of Desh Bhakti and all. So if we really want, to do something for our nation, this is the time that we Indians can prove that we really care about the nation, we care about our community.
Ma'am, thank you for joining us in Sarvani Samvaad. You know that the pandemic has caused a lot of panic throughout India, and people are dying. What do you have to say exactly? What is this virus that has created
See,
this problem?
coronavirus, or the name for the virus, the novel COVID-19, it is a SARS variety type 2 virus. Fine. The origin of the virus is from Wuhan, which is a province in China, as we all know. Basically, the virus originated from bat, then there was a transmission to human being, and further has been reported human to human transmission. So basically, it originated from an animal, then got transmitted to human being, and since then it is spreading throughout the world. Fine. This virus primarily affects the respiratory tract of a human being. It causes both upper respiratory symptoms as well as lower respiratory symptoms. Fine.
Ma'am, there's a lot of talk about that if you eat non-vegetarian food, or you even newspapers can spread this virus. Can you please throw some light at how this virus spreads?
See, it's important to understand the mode of spread of this virus. Fine. There are primarily two main mechanisms by which this virus spreads. The first is the droplets spread. For example, if there is a patient or a carrier for this virus, he coughs. So the droplets, the cloud of droplets, which he sneezes or coughs, that kind of settles on the fomites, or that can be taken in by another person who is in front of that patient or a carrier. So that cloud of droplets, when the person in front inhales, the virus in that can settle into the mucosa of the respiratory tract, where it can start multiplying. Fine. And then it can cause symptom in that patient. Similarly, if the carrier or the patient has cough on a fomite, by fomite I mean any surface, any metal or any substance which has come in contact with the respiratory droplets, the virus will stay on that object. For example, a person has coughed and the droplets have settled on the metal surface. If another person touches that metal surface, and then by chance he puts the hand on the face, so what happens, the virus from the patient gets transferred to the metal surface, and from the metal surface it gets transferred to the hands of another person, and then when he puts those hands over his face, the virus gets transferred to the person, and again begins the whole cycle. It starts multiplying in the respiratory tract and then causes disease and symptoms in the other person. Now, the third concept, which has been, really talked about, is the airborne spread. It was said that earlier that it's a droplet spread, but now new theory is coming up that if a person has coughed or sneezed, the virus cloud or the virus particles can remain suspended in the air for about 8 hours. So even if the patient is not around the area where another person is coming, and the person comes in the place where even 8 hours prior, within 8 hours, the patient was there, he can inhale that virus cloud and he can get the infection. Earlier, experts were saying that if the person who is not infected, he is not supposed to wear the mask. But this theory, which says that the spread is airborne, that virus can remain in air for 8 hours. So now they are promoting that each and everyone should wear a mask.
Ma'am, that's a wonderful information because earlier it was said we were reading WhatsApp messages which were talking about that, after 24 hours, after this curfew, every virus, whosoever is infected, the place is infected, it'll get disinfected. Now we know that it's not like that. It can spread anywhere around, and wonderful information. I mean, I want to know.
Like to reiterate, the fomite spread is very important. Like,
Okay.
for example, the question you were asking about the newspaper. For example, we create a hypothetical scenario. The newspaper person who delivers the newspaper to your home, or the one who is working in the printing press, for example, he is infected.
Hmm.
So he is coughing and all the virus is getting stuck to his hands. Then he is putting his hands over the newspaper, and when those newspaper, I mean, that reaches to your home and you touch the same newspaper,
Hmm.
fine. Then
Hmm.
again you put your hand over your face. Then you are getting that virus in your body through the fomite, and the fomite here will be newspaper.
Okay. So,
That's why, yeah,
what
yeah.
precautions can we take? Because we need newspapers to be informed. People
See,
will stop.
I suggest, see, now you must have seen, got the new WhatsApp, that all the newspapers are bringing the electronic version. So
Digital,
I
yes.
will, yeah, the digital version. So I will suggest kindly avoid any hard copy of newspaper. The second thing which I would like to suggest, that avoid this Zomato, Swiggy, or any online food delivery, because again, it has been seen that on cardboard, I mean, most of the food gets packaged within the cardboard, that the virus can stay there for about 24 hours.
So that's
Again, you don't know about the status of the person who is making the food, who is delivering the food.
yes, definitely.
So these things are very important. By these we can kind of break the spread of the virus. Similarly, online shopping, I will suggest you should not go for that, at least for a few coming months, so that we do our little part in prevention of the spread of the virus.
Another query is that we are not sure. Like people are saying, if you have cough and you have fever, then only you are infected. These are the symptoms. What are the other symptoms of this virus?
See, you have to understand, there is a difference. Usually, you must, or I mean, all of us get fever and sore throat during winters. That's the common flu. Fine. There is subtle difference between the two. These common flu, the incubation period. Now, what is incubation period? Is the time when you get infected to the time you develop symptoms. In case of common flu, the incubation period is like 2 to 3 days.
Hmm.
Fine. But in case of the coronavirus, COVID-19, it has been seen the incubation period varies from 2 days to 2 weeks. And in some cases, it has been seen to 3 weeks also. So on an average, if we take median, it is about 5 to 7 days. So the incubation period of the coronavirus is more. It's much more than the common flu. Now, what implication this has in the spread? That if in flu we get symptoms quickly when we come in contact with a patient, the second person develops infection quickly within a day or two. But
Yes,
here it takes time. So what happens in that incubation period? The person acts as a carrier, and he spreads the
the
infection
virus.
to many, a virus to many people. That's the reason why the infectivity is, so many cases come up, like there is an exponential growth. Like we you just said, over a day so many cases, new cases have come up. So
Yes.
that is one thing. Second thing, the both common cold and or in the common language we say flu, and this coronavirus, they both have similar symptoms. Like you can have fever, you can have sore throat, you can have a bit chills, you can have myalgias, I mean muscle aches and all. But there are some differences clinically. uh, the symptom of diarrhea or the abdominal gastric upset, this is not seen usually in flu. This is present in coronavirus, COVID-19 infection. So a patient of COVID-19 will have diarrhea. which is usually not seen in flu.
So we can actually find out the difference between the two if
Yeah,
we
yeah, yeah. But there is
diet.
a very thin line,
Yes.
very thin line. Second, usually the flu does not lead to lower respiratory tract infection. By lower respiratory tract infection, I mean pneumonia,
Okay.
which is consolidation in which the lungs alveoli get filled with water. This is usually not seen in flu, but in the COVID-19, it is good amount of people can have pneumonia. Fine. So the severity, if we talk about in terms of severity, yes, the COVID-19 is more severe compared to flu. But it is not that all the 100, if for example 100 patients of COVID-19, they will all end up in flu. No. You can say around 5 to 15% of the people infected can have the lower respiratory tract infection.
Okay.
Third thing is that the mortality rate. The mortality rate with flu is 0.1%. That is 1 in 1,000 patient will die due to flu. Fine.
Okay.
But in case of the coronavirus, it is like 1% to 8%. In South Korea, we have seen it is around 1%, and in Italy, it has touched 8 to 9%.
Yes.
So if we see, like, even if we take 1% mortality, that was in South Africa, so 0.1 for flu and 1% for the coronavirus. So the death rate with coronavirus is 10 times more than flu, which is pretty high number.
Which is high.
Yeah,
That
so
we need.
that's why it is, it's causing so much panic, one thing, and infectivity is also high for the coronavirus. Fine.
So
And
ma'am,
another point,
yes.
the course, flu usually settles within a week, but the course of coronavirus infection is a long, progressive, and delayed one.
Okay.
Usually doesn't settle in 7 days,
Okay, ma'am.
right?
And most people, have this theory that this virus can only affect people who are older in age or younger because of their immunity. So, do you believe that death rate is higher in people who are older because they have low immunity, or it can happen to any of
Yeah.
us?
There are some high risk groups which are more susceptible to this infection. Those include old age patients more than 60 years,
Okay.
fine, pregnant females, uh, uh, people who are having diabetes, who are on antihypertensive medicines, have cardiac issues, and those who are on those who are having autoimmune diseases like lupus, rheumatoid arthritis, or those who are having on steroids and other immunosuppressive medicines. So yes, the susceptibility to the disease, to getting infection, and then obviously the having fatality with the disease is high in the this high risk group.
Okay, ma'am, what do you see the future of this 21 days lockdown in India, which is happening right now? Do you
Yeah.
think that will extend, or we will see any recovery during this 21-day period?
If
What your views are regarding
you see
this?
the latest ICMR guidelines,
Hmm.
they have clearly said that 21 days is not enough. We need more than like around 49 days for, if we do a lockdown of complete 49 days. That 49 days should be absolute. As we are seeing that in the news channel, the migrants are going back to their villages and all. So ideally, abhi tak ka whatever period we have spent in lockdown, I think that is zero. To me, that is of no use. So if we are talking about lockdown, it should be complete lockdown, absolute lockdown. Then only we can expect that there is. See, there is idea of flattening the curve, which you must have read and heard a lot these days on internet.
Yes.
Basically, what is the idea or the concept behind the lockdown?
Hmm.
Uh, See, what happens when there is infection or a pandemic? There is so much faster, exponential spread of infection. So we get a curve like this, fine. So, but the healthcare system, the resources, they are limited. So if we have at a particular point of time so many patients, visiting to the hospital, so
Yes.
many patients, yeah, needing ventilators, ICU support. So there is almost, healthcare system will almost collapse. That is what has happened in Italy, and what is going to happen, in future in England, in UK. So we don't want that, as we are a developing nation, third world nation, we cannot compare our health system with the Italy and UK, which are much more developed than us. So imagine if we get so many patients, at a single point of time. So I mean, our healthcare infrastructure, everything will
We're not
collapse.
equipped for
So
this. No.
the idea of lockdown is that the curve, instead of being like this, should be like this. The number of patients affected will be same. It's not that it will be less. It will
Okay.
be same, but at a particular point of time, the
The
number of
rate will be
patients,
slow. You're talking
yes,
about.
so that our healthcare system is not overburdened. Imagine, I mean, we have just 40,000 ventilators all over India, and we are 1.3 billion population. So imagine, I mean, at a single point, if we expect the spread just like 8% spread in the 8% mortality rate in the Italy. So imagine how much havoc it can,
Create in the
cause in
country.
the Indian population. So the idea of lockdown is to flatten the curve, is to decrease